Alright, welcome again. Let's continue with one more online lecture. Heart failure. This term is used to describe a point at which the heart cannot supply enough blood to meet the body's demands. This can happen in two ways. Either the heart ventricles can't pump blood hard enough during systole, what is called systolic heart failure, or not enough blood fills into the ventricles during diastole, which is called diastolic heart failure. In both cases, blood backs up into the lungs, causing congestion or build-up of fluid, which is why it is often known as congestive heart failure. So congestive heart failure affects millions of people around the world, and since it means that the body's needs are not being met, it can lead you to death. Part of the reason why so many people are affected by heart failure is that there are a wide variety of heart diseases like ischemia or valvular disease that can impair the heart's ability to pump out blood and over time can cause the heart to fail. Okay, so as usual, here you have the objectives of the lecture, which is this lecture is a bit tricky, but I hope it's clear enough. Let's go with it. And we'll start with systolic heart failure. Although you'll see that the terms here are very related to each other, and that's the tricky thing to get. All right, the heart needs to squeeze out a certain volume of blood every minute. We call that the cardiac output. We can also call it, we can rephrase it as heart rate, or the number of beats per minute, multiplied by the stroke volume, which is the volume of blood that is squeezed out with each heartbeat. The heart rate is pretty intuitive. So you beat 70 times, you beat 50 times, very easy to understand. But stroke volume is a little more tricky. For example, in an adult, the heart might beat 70 times, let's put 70 times per minute, and the left ventricle might squeeze out 70 milliliters per beat. So 70 per 70 equals the cardiac output, that in this case is going to be 4,900 milliliters per minute. All right, so almost 5 liters per minute. That's what the heart pumps. But if you look the heart contracting, you'll notice that not all the blood that enters the ventricle is squeezed out into the aorta. Normally, there is a small quantity that remains in the ventricle after a stroke and mixes with the coming blood from the corresponding atria. That means that the stroke volume is only a fraction of the total volume inside the ventricle. So let's say the total volume, the normal total volume will be like 110 milliliters, okay? And 70 milliliters is what is the fraction that is really ejected into the aorta with each beat. The remaining 40 milliliters stay in the left ventricle until the next beat, right? So in this example, the ejection fraction would be 70 divided by 110, and this gives a value of 64%. So a normal ejection fraction is considered between 50 and 70%. Between 40 and 50, that's considered borderline. And anything about 40 or less is indicating systolic heart failure because the heart is only squeezing out a little bit of blood of the total one. So, in our example, if the total volume of the left ventricle was 110 milliliters, but we have a patient that only 44 milliliters are pumped out in each beat, then you have that 44 divided by 110 milliliters give us 40%. And we would say that this person is in systolic heart failure. Now, in addition to systolic heart failure, which is that the heart doesn't pump enough because it's not squeezing enough quantity, we also have diastolic heart failure, which is where the heart is squeezing properly, hard enough, but it didn't feel quite enough. So in this case, again, the stroke volume is low, but the ejection fraction is normal. So, all right. So you see, how can that happen? Well, it is not feeling enough. So there is a low total volume. Let's say that 69 milliliters. Okay. Well, but we are in this case we still have 44 milliliters that are squeezed out. So if we divide 44 by 69, we get a percentage of 64%. And remember, that was considered normal. It's between 50 and 70. All right, so in this situation, the failure is caused by abnormal filling of the ventricle so that the chamber doesn't get fully loaded in the first place. And another term that is medically used is to have a reduced preload, which is the volume of the blood in the ventricle right before the ventricular muscles contract is not enough. So an important relationship between systolic and diastolic function is the Frank-Starling mechanism. This basically shows that loading up the ventricle with blood during diastole and stretching out the cardiac muscles makes it contract with more force. Right? So this increases the stroke volume during systole. This is kind of if you have a rubber band, the more you stretch it, the more it's going to snap back when you release it. All right, but we will see that this is not is a proper compensating factor for mechanism for short situation. But if the situation, the problem is chronic, this is gonna take us to more problems. All right. So heart failure can affect the right ventricle or the left ventricle or both ventricles. So someone might have right-sided heart failure, left-sided heart failure, or both, which is called biventricular heart failure. Each of which can have systolic or diastolic failure. Having said that, if less blood exists either ventricle, it will affect the other. Okay, so here you have the arrow, the black arrow connecting the two ventricles. Okay, because the two ventricles, they work in series. So left-sided could cause right-sided and vice versa. So these terms really refer to the primary problem affecting the heart. Basically, which one was first. Alright, so usually left-sided heart failure is caused by systolic dysfunction. And this is typically due to some kind of damage to the myocardium, which means that it cannot contract as forcefully and pump blood as efficiently than it should be. Alright, so ischemic heart disease caused by coronary artery atherosclerosis is the most common cause. In this case, less blood and oxygen gets through the coronary artery to the heart tissue, which damages the myocardium. Sometimes, if the coronary is blocked completely and the person has a heart attack, they might be left with scar tissue that doesn't contract, you know that, which again means the heart can't contract as forcefully. Long-standing hypertension is another cause of heart failure. This is because as our arterial pressure increases in the systemic circulation, it gets harder for the left ventricle to pump blood into that hypertensive systemic circulation. To compensate, the left ventricle actually bulks up and its muscles hypertrophy so that the ventricle can contract with more force. All right, so it will be stronger. The increase in muscle mass also means that there is a greater demand for oxygen, and to make things even worse, the coronary arteries get squeezed down by this extra muscle so that even less blood is delivered to the tissue. More demand and reduced supply means that some of the ventricular muscles start to have weaker contractions, leading to systolic failure. Another potential cause would be dilated cardiomyopathy, where the heart chamber dilates or grows in size in an attempt to fill up the ventricle with larger and larger volumes of blood, and stretches out the muscle walls and increase contraction strength via the Frank-Starling mechanism. Even though this can actually work for a little while, over time the muscle wall gets thinner and weaker, eventually leading to muscles that aren't so thinned out that it causes systolic left-sided heart failure. And ultimately, the ventricle walls need to be the right size relative to the size of the chamber in order for the heart to work effectively. Any major deviation from that can lead to heart failure. All right. Even though systolic failure is most common in the left side heart, diastolic heart failure or feeling dysfunction can also happen. All right, so this is not running. Okay, in hypertension, remember how the left ventricular hypertrophied? Well, that hypertrophy is concentric, which means that the new sarcomers are generated in parallel with existing ones. And this means that as the heart muscle wall enlarges, it crowds into the ventricular chamber, resulting in less room for the blood, meaning that in addition to contributing to systolic dysfunction, hypertension also causes diastolic heart failure. So, concentric hypertrophy leading to diastolic failure can also be caused by aortic stenosis, right? Which is a narrowing of the aortic valve opening, as well as by hypertrophic cardiomyopathy, which is an abnormal ventricular wall thickening, often from a genetic cause. Also, restrictive cardiomyopathies are another cause for this problem. And in this case, the heart muscles get stiffer and less compliant, and therefore the left ventricle can't easily stretch out and fill with as much blood, which leads to diastolic heart failure. When the heart doesn't pump as much blood, there is decreased blood flow to the kidneys, and this will activate the renin-angiotensin-aldosterone system, which causes fluid retention. And this excess fluid fills the heart a bit more during diastole and increases preload, which in turn increases contraction strength, again by the Frank stalling mechanism. But just a minute. All right, but just like with the other strategies, in the long term, retaining fluid so that more fluid remains in the blood vessels typically leads to a large portion of it leaking into the tissues and can contribute to fluid buildup in the lungs and other parts of the body, which can worsen the symptoms of heart failure. All right, so a major clinical sign of the heart not being able to pump enough blood forward to the body is that the blood starts to back up into the lungs. A backup of blood in the pulmonary veins and capillary veins beds can increase the pressure in the pulmonary artery and can also result in fluid moving from the blood vessels to the interstitial space, and that's what we call an pulmonary edema or congestion. In the alveoli of the lungs, all this extra fluid makes oxygen and carbon dioxide exchange a lot harder, since a wider layer of fluid takes more time for the oxygen and carbon dioxide to diffuse freely through it. And therefore patients have also dyspnea, which means trouble breathing, as well as optopnea, which is difficulty breathing when lying down, since that allows the venous blood to move back from the legs and the gut to the heart and eventually into the pulmonary circulation as well. This extra fluid in the lungs causes crackles or rales that can be heard on auscultation with a phonoendoscope while the patient breathes. All right, so for left-sided heart failure, certain medications can be prescribed to help improve blood flow. And you have the angiotensin converting enzyme inhibitors, which help dilate blood vessels, as well as diuretics to help reduce the overall fluid built up in the body, which will help prevent hypertension for worsening the heart failure. All right, so I stopped the heart because it distracts a bit. So let's switch gears and think about right-sided heart failure, which is actually often caused by left-sided heart failure. Do you remember how fluid built up increased pressure in the pulmonary artery? Well, this increased pulmonary blood pressure makes it harder for the right side to pump blood into it. In this case, the heart failure would be biventricular, since both ventricles are affected. Someone can also have isolated right side heart failure, and an example of this would be a left to right cardiac shunt. In these cases, there might be a cardiac shunt like an atrial septal defect or a ventricular septal defect that allows blood to flow from the higher pressure left side to the lower pressure right side, which increases fluid volume on the right side and can eventually lead to concentric hypertrophy of the right ventricle, making it more prone to ischemia, which is a systolic dysfunction, and have a smaller volume that becomes less and becomes more less compliant, which is a diastolic dysfunction. Another potential cause is for isolated right side failure is chronic lung disease. Lung disease often makes it harder to exchange oxygen, right? So in response to hypoxia, the pulmonary arterioles constrict, which raises the pulmonary blood pressure. This, just like before, makes it harder for the right side of the heart to pump against and can lead to right-sided hypertrophy and heart failure. When chronic lung disease leads to right-sided hypertrophy and failure, is known as cor pulmonale. Remember that with left-sided failure, blood gets backed up into the lungs. So, in the other hand, with right-sided failure, blood gets backed up to the body, and the patients may have congestion in their veins of the systemic circulation, and we'll see what that causes. So, one common manifestation of veins congestion is jugular venous distension, where the jugular vein that brings blood back to the heart takes on more blood and becomes large and distended in the neck. Also in the body, when blood backs up to the liver and the spleen, fluid can move into the interstitial spaces within those organs and they can become large, and this is called hepatosplenomegaly, which can be painful. And in the liver is if the liver is congested for long periods of time, patients may eventually develop cirrhosis and liver failure, which would be called cardiac cirrhosis. So, excess interstitial fluid near the surface of the liver and the spleen can also move right into the peritoneal space, and since that cavity can take a lot of fluid before there is a minimum increase in pressure, a lot of fluid can build up in the peritoneal space, which is called ascites. And finally, fluid can that backs up into the interstitial space in the soft tissues of the legs may cause pitting edema, where the tissue is visible swelling, and when you apply pressure to it, it leaves a pit and takes a while to come back to its original place. This is generally affecting the legs of people because gravity is helping and causes the majority of the fluid to pool in the dependent parts of the body, which these are the legs when you are standing, or the sacrum, essentially the lower back when you are lying down. Alright, so right-sided heart failure will be treated similar as left-sided heart failure, especially because it is often a result of left-sided heart failure. Therefore, medications like angiotensin-converting enzyme inhibitors and diuretics may be prescribed also here. All right, so with heart failure, we saw that sometimes the muscle wall can stretch and thin out, or sometimes it can thicken and become ischemic. In other case, those heart cells get irritated, and this can lead to heart arrhythmias. With an arrhythmia, the ventricles don't contract in synchrony anymore, and this makes them less able to pump out blood, worsening the whole situation. In some cases, patients might be treated with cardiac resynchronization therapy with pacemakers, which can stimulate the ventricles to contract at the same time and potentially improve the blood pump out. If that doesn't work, for heart failure in general, some people may have ventricular assist devices implanted, which literally assist the heart to pump blood. And in end stage situations when nothing worked properly, patients may have a heart transplant. Okay, so enough for today, guys. That was all for heart failure. A bit dense, so hope you review it several times until you understand it properly and get the trick in it. See you in a while.